your color, your skin color. And so one of the things the doctor would see when he notices that your complexion has changed, somewhat looking some kind of greenish yellow or yellowish green or pale, all right, then it could suggest to the HCP that this person could be having hepatitis. The category of doctors or the categories of internal medicine practitioners that manage hepatitis are those we call the gastroenterologists. The gastroenterologists are the class of doctors that handle this kind of case. So if you are going to a hospital and you walk into the GOPD where you have the GPs, general practitioners, if he suspects that you may have hepatitis or some kind of liver disease, he may now refer you. He may refer you to somebody is loving us there. Please, can we meet him? He may now refer you to the gastroenterologist. All right. So again, you call off your eyes to know if there is already a presence of sclerosis. So because once you have those proteins too released into the blood, of course they'll go around to your system, including your eyes. So ultimately the color of your eyes too will also change. The whiteness, that white part of your eye will also change. You'll be looking somewhat yellowish. All right. Then it could suggest that this person could be having a liver disease. More often than not, once there is an inflammation of the liver or when there's a liver disease, you will always see a change in color. You will always see a change in color, generalized color change, both in the eyes and the skin all over. All right. And then you may experience swelling around your leg region, lower leg, especially the lower part of your feet. Okay. You experience swelling like a pregnant woman. When a woman is pregnant, sometimes they may have this edema or swollen feet. That swollen feet is actually as a result of changes around the woman's system that has resulted in certain release of certain proteins. Hormones are proteins. So when there is some form of change in the hormonal integrity or the hormonal structure or the normal tissue balance of a person, of course, when a woman is pregnant, there is a change. Something is growing inside of her. A lot of things are being released from the mother to the child, and even from the child to the mom. And so there are certain responses from the child, responses from the woman's system that will result to certain release of certain proteins that will cause that swollen feet. So when the doctor also observes that there is a swollen feet, it could be suggestive. Please, somebody here is echoing. Can we meet that person, please? Thank you very much. So when the doctor observes that there is swollen feet, it could be indicative for hepatitis C or any of the hepatitis. All right. Then you also have tenderness or swelling in your swollen abdomen, because of course sometimes you have the person having a protruded stomach. There are persons you would see. All right. You will see somebody when you see somebody that has an enlarged abdomen or swollen abdomen, more often than not, it is a liver problem. So when you go to most gastroenterology clinics, you will find that a couple of the patients, they will have swollen abdomen. And the reason is, like I think I have mentioned that a couple of times, there are proteins that have been released. There are certain kind of imbalances that have gone on in the liver. And so once there's an inflammation, the liver may also enlarge. The liver starts being enlarged because there's an inflammation. The liver has been inflamed. the cells are beginning to multiply. The viruses are taking over the space. I know the viruses will take over. They will even be acting like the host cells or the host genome, the host DNA. That is why treating viral diseases is quite difficult. It is also the reason why till date, science have not been able to come up with a direct treatment for HIV and AIDS. The reason is because the HIV virus behaves like the human virus, the human DNA, the human genome. All right, the way the RNA translates, that is similar way that the virus also behaves. So the body will see the virus like its own. So whatever method you want to use to destroy the virus, you also be destroying the human cells, the whole cell. And so it is very, very difficult to manage. And they are able to easily mutate, easily change to any form. So it is difficult to treat those viruses. All right? Yes, hepatitis virus is not HIV virus, but they also behave in similar ways. Their viruses are difficult. Viruses, they are not like bacteria. The bacteria they have a definite structure. It's either you use medications, antibiotics that can attack the peptidoglycan, or you use antibiotics that will attack the cell wall, or use antibiotics that may even attack the nucleus, all right, of the bacteria. But for viruses, they're not like that, because viruses outside the host, they are dead. Viruses are only alive when they are inside a living host. If you see the virus outside the living host, it's as good as a non-living thing. So it is usually difficult to treat or to manage. That is why we have to take these information we get here very seriously, and every preventive measures that Prof had mentioned, you must take them very seriously. Because if you come down with a viral infection, it is not easy to manage. Okay, so let me move on. So there may also order blood tests. Why are they ordering the blood test? It is very simple. Because the major mode of transmission or transfer is actually through fluids. So you use an unsterilized object, all right, maybe a syringe or whatever it is, that has been used by an infected person, and you use the same object or the same syringe, all right, you also will get the problem. You could get infected if that tool or device is not sterilized. Again, since it is fluid, what other way can you get fluid transmitted? Sex, unprotected sex. So when you have an unprotected sex, all right, you have sex with someone who's already infected. Again, why it is very easy to contact, all right, or to contract, is because someone can actually have this virus, hepatitis C virus infection, and could remain asymptomatic for more than 10 years. The person would look normal. The person would not show any sign of that infection. So you will not even know. Just as they say, HIV is not the shape of face. Hepatitis C too, not the shape of face. So you're not going to know. So when the person is infected and you have a sexual intercourse with such person, you get it. And the irony of the matter is that you will contract the virus, and yours may not be like that one, because your own body system is not the same as the other person. And so you that have contracted it, the secondary partner, you could get the symptoms in less than 6 months, whereas the person who has given you that virus is still looking healthy. He's still looking asymptomatic, and will be busy dashing people free hepatitis C. Okay, so that's that on the blood test. Another thing they will also look at is the antibody test. The antibody test is this. Because when there is an infection is simply a presence of a microorganism in a pet system such that it is pathogenic or such that it is virulent, all right, or it is causing a disease. So when we say infection, it's not because when somebody has infection, the person can get scared. When we say infection, it could be anything. Malaria is an infection. Typhoid is an infection. Anything that has a causative agent being a microorganism is an infection, right? And so once there is an infection, it means there's a presence of a foreign matter, a foreign agent inside the human system. So what happens? Once the body recognizes that something foreign has entered, what happens? The body naturally will set up, mobilize its antibody system, the immune system, the phagocytes and all that will come into play. And then the antibodies are also proteins. What do? They target specific antigens or specific foreign agents, all right, and are able to deal with them. And so once there is an infection, antibodies against those antigens or those viruses would be produced by the body. It is natural. That is why when you have flu virus, all right, even when you don't take anything, and you just drink enough water. Unfortunately, I was not here the night we had the discussion on water. Once you just drink enough water, and possibly you just take 1 or 2 immune boosters of vitamin C and all that, you'll be fine. Why? Because the flu does not have any particular cure. A flu is a viral infection, and the host cells naturally deal with it. Well, how do they deal with it? They produce antibodies that get rid of them. So the vitamin C and the immune boosters you take is just to reinforce, it's just to boost the antibody, to boost the immune system to get rid of the flu. The same thing happens when there is a viral infection in the class of hepatitis C. So the body will naturally produce antibodies. So if I want to test you to know that to check if you are infected with hepatitis C, I can run an antibody test, a hepatitis C antibody test. It means those antibodies that are specifically produced when there is a hepatitis C infection. So if I test your blood and I see those proteins, those antibodies, then because antibodies are specific to antigens. Antibodies, please note, underline this line. Antibodies are specific to antigens. So if there is a presence of hepatitis C antibody, it simply means that there has been an infection by hepatitis C. All right? And so that's what I want to take. And then you also can run an RNA test, because the virus itself is an RNA. It's an RNA virus. Like I told us before, the viruses they behave like the human DNA, and you know the DNA gives birth to the RNA. The DNA replicates, right, to RNA, all right, and then the RNA is now converted to protein through a process called translation, all right. And so when you see the virus, we can run an RNA test. The RNA test will tell us what kind of RNA it is, if it is hepatitis C RNA or the normal human cellular RNAs, which could be the ribosomal RNA or the messenger RNA or transfer or any kind of RNA. But we can actually run this genotype testing or run this test either via PCR polymerase chain reaction, all right, to amplify the genome, to know if it is RNA or DNA, or if it is hepatitis C RNA. All right, it is also very effective to run that test. Okay, and then again, in order to treat, before I get to the treatment, maybe I will talk about that in the treatment, because the virus itself has different strains. Hepatitis C virus is also one of the reasons why it is not so easy to treat a lot of viral infections, even hepatitis C. If you are not able to identify the type, the strain of the virus, you may be using the wrong antiviral medication. And so it's important that what's it called? It's important that the strain of the virus is identified to know the right medication to use to treat them. The good news is that yes, for not cirrhosis, but hepatitis C virus, there are actually treatments for them. Okay, let's look at the treatment now. The most common way to treat hepatitis C is the DA. The DA simply means direct acting antivirus. What it simply means that there are specific antivirals. The word antiviral simply means drugs or medications that can combat viruses. Antibiotics simply means drugs or substances that can combat bacteria. That's antibiotics. All right. Antifungal simply means drugs or substances that can combat or get rid of fungi. Okay, I just want to make this clear for us to understand. So when we say antiviral, it simply means drugs or medications that can help us get rid of viruses. All right. We also have what we call antiretrovirals. The antiretrovirals are specific medications that are used to bring down the load, the viral load, for patients who are HIV positive. Okay, so for hepatitis C virus, we also have, we can use the DDA. The DAs, that's the direct acting antivirus, and there are quite a number of them. And these medications are not cheap. Please get that. They are not cheap. So if you get this one, a big man disease, because if you get them, you need to get money. Antivirals are very expensive, and that is why a lot of the time you have NGOs, that actually run some kind of free donations and all that. But the processes are not very easy. I work in a company where we sell anti-cancer drugs, and one of those medications was going for about 300,000 plus for patients that have leukemia. All right. Unfortunately, we don't give it out for free. So the only place it is given for free in Nigeria here is at Ife. So if the patient has that problem here in Lagos, they have to find their way to Ife to get free donations from some international NGOs. But you also know that the cost of your transportation and even the safety is not guaranteed. And those medications you also take, what they will only do is to give you more or less like a lifeline. Maybe adding 5 years or 6 years to the little life you have left. They don't cure you. They don't stop the problem at the end of the day, right? Now for antivirals for hepatitis C, especially when it is still in a mild state, it is actually treatable. You can use any of these antivirals as prescribed by the doctor to be able to manage or treat these problems. All right. But again, like I said, if the hepatitis C has gone beyond normal, if it's a chronic case and it was identified late in time and it has led to cirrhosis, cirrhosis is not hepatitis C. Cirrhosis is a damage of the tissues. The tissues of the livers, Dr. mentioned, that are no longer connected. So you're having bad tissues replacing the good ones. And so the liver's integrity or functionality is punctured. So, and the liver cannot function. Doctor has told us the functions of the liver. I cannot overemphasize. The liver is one of the few vital organs we have. The liver, the kidney, the brain, the heart, the lungs. These are 5 powerful organs. If any of them is affected, we have what we call comorbidities. Comorbidities. What it means is that one problem could be leading to another problem. So if you have a liver problem, there's a high tendency that your kidney may come into play, because they work hand in hand. That's it's like it's a complete. God, our God is I don't know how God is. The way God designed man is unexplainable. So each time I look at the human body system, I see how powerful and how sophisticated the wisdom of God is. You know, how are you able to create a human being that it's like a vehicle, a car, every part is connected. And so if you think this one does not affect the other one, you are wrong. So the liver, the kidney, if you go to most teaching hospitals, patients who come down with liver problems, watch, they are more likely going to have kidney problems. Patients who have hypertension or cardiac problems are more likely going to have kidney problems. So they usually treat them together. So it's difficult to find a patient that does not have a heart problem and kidney problem. Because once your heart is down, your kidney will start crying. They are brothers and sisters. The same thing with the liver. Because the liver and the kidney are working hand in hand. There are certain veins and arteries that are connecting these organs. So if one is bad, if there's an inflammation in your liver, it's not a good thing for other organs, especially the kidney. And if your kidney is down, I don't know. Only God will help you. Either of them. Even the kidney, one can be bad. If you have a kidney infection or kidney failure of one of the kidneys, the other one can keep going for a while, right? But if your liver is down, there's only one liver. Once that liver is down, there's no other way. So if there's cirrhosis, the only option you have is transplantation. And transplantation is not cheap, because it's not easy to get a liver donor. You can be on the waiting list for more than 2 years. It's not like liver. It's not like kidney that somebody can just donate. Liver, if you donate your liver, you don't go with that now. So you don't have free donors. All right? You don't have free donors. And so the few livers they have must have been harvested from healthy people, healthy dead people. Somebody dies and decides to donate his liver. Say, because I'm dying, please, you can harvest my liver and put it in the liver bank for people who may have liver problems, who may need the liver, right? So you can imagine the competition, comparing it with the high demand of liver. So it's not something you should joke with. Every information you take here should be digested, and we should follow, these preventive measures so that we don't come. All right. So what on the DAA, there are also antibiotics, and if once there's an inflammation, yes, these bacteria are also very opportunistic. So there are bacteria that are naturally residing around your GI, even around your liver. And so, but when the liver is proliferated, the viruses, they are proliferated, they are multiplied, and is inflamed, it will give room, and the tissues are being damaged. It will give room for bacteria to also come in. So bacteria that are naturally, they will come there and start misbehaving. So sometimes, while you're also treating the viral infection, you may also need to use antibiotics to manage or treat the infection, the bacterial infection, if they have been diagnosed. All right. So these are the basic treatment methods for liver disease, hepatitis C. Again, just to add a few things about the stem cell. Now, if you listen to everything we have said so far, the liver, the hepatitis C virus infection is simply an inflammation of the liver, right? And what it means is that once there's an inflammation of the liver cells, it means that the cells will die. The good cells are taken over, are being taken over by bad cells that have been taken over by viruses. And so, whatever treatment regimen you want to use, you want to adopt, the essential goal would be to redeem the integrity of the cells, to bring back the cells, the life of those cells. How do we rebuild new cells? And the rebuilding of new cells can be done by the stem cells, because the stem cells have the capacity, the capability to also proliferate into they can differentiate into different kinds of cells, including the hepatocyte. The hepatocytes are the cells that are found in the liver. So taking stem cells therapy till date, I think there are researches that have been done in some countries, but the human stem cells, few studies are yet to be done on the plant stem cells. But whatever it is, whether it's human or it's plant-based, the main thing that is there is that is a stem cell. And so it has the capacity to rebuild, all right, the damaged cell. So if the cells are rebuilt ultimately, all right, you can solve that problem. So what it means is that it will be very good to treat the patient with the antivirus and the stem cell therapy as a conjugate, all right? Because you will need to get rid of the viruses. The antivirus will simply target the viruses, right? And the point is that once the viruses are targeted and taken out, over time, the person should get well. But if you treat that patient alongside the stem cell therapy or STC, what it means is that the damaged cells will be rebuilt. So whilst you are getting rid of the viruses, you are also rebuilding the cellular life. And so the person will now have more or less like a complete healing process. The person will have a complete healing process. So the liver becomes completely rebuilt. All right. So thank you very much for your time. I appreciate you all. God bless you. Over to you, sir.
Thank you, Fam. We are very, very grateful for the wonderful work you've just done. We are very, very grateful. We appreciate your effort. Please just bear with me. Just give me a minute. At this point, please, because of our time, I want to call on Mr. Sampson, our orator. Coach Sampson, is Coach Sampson there?
Hello, Coach Sampson. That's good.
Hello, good evening.
You're welcome. Go ahead.
Good evening. Good evening, everyone. Super. Thank you, Dr. Tilaka, for that wonderful and expository on hepatitis C. I was going through WHO, about hepatitis C based on, and I thought based on what Dr. Rose did, about 50 million, people in the world, and they have to relate about 1 million. And unfortunately, as well, so
we can hear you from this. Hello, Samson. Hello. Hmm? Please, just the network challenges. Just give me a few seconds.
Sorry, I think maybe network. I don't know. Like from like just the treatment needed antiviral, because like you said, virus is one of the, I used to say, is one of the most dangerous diseases to treat, more than every other disease, because they have ability to mutate and they stay on your old cells and they multiply. And that's why it's very, very, very system that giving us a product that can deal with these deadly diseases. So there is no cause for alarm. So if you have anyone suffering from hepatitis, any kind of hepatitis, even particularly the hepatitis C that we're treating tonight, I want to say good news to every one of you there, or maybe any of your family member that you know, or anyone that you may know that will contacted this virus. It is a blood-borne diseases, like Pharma and Dr. Asel, that is transfusion is through blood transfusion or any kind of blood. It can be through sexual, or through kind of injections and so many other, but it is a blood-borne diseases. That is why it is also dangerous. Like I used to tell people, I say the power of life and death is in the blood. So it is very, very important. So, but thank God for Super Life, like I said, they have a proper solution to these deadly diseases through our, stem cell organic product that is working at the cellular level. Like Dr. Kama, rightly said there. You try to explain the scientific, approach of how virus operate in our body. So, and it is always on the old cells, so cellular level. So we have a product that can also work at the cellular level. So it makes it very, very easy to solve this problem, despite how dangerous it is. So Super Life SC30, it is, when you look at in our page, there is what we call we say Super Life is anti-UV, antioxidant, anti-inflammation, and so it is, and like you said, the hepatitis B or C that we're picking tonight is an inflammation of the liver. It's an inflammation of the liver. So that is why, and because SC30 is also, the anti product. It is anti-inflammatory, antioxidants, and anti-inflammation. So that is, if your liver is inflamed because of the challenges of hepatitis C, SC30 has ability also to tackle your problem. Look at it also. It is also unlocking the potential of your cells. Like you say, it has ability to work from the cellular level, and being a stem cell product, it can penetrate into your host cells and then take care of those your ingredient we have. So, which is look at it. It says apple stem cell rich in epigenetic factors and metabolic, which help in treating of your cells. You can repair damaged cells or tissues or organs. So, like inflammation of the liver can lead to liver cirrhosis or liver damage. If this has occurred, the SC30 has the ability to repair the damaged cells of the liver or the tissue or even the organ, the liver as organ itself. Also protect human cells against UV-induced death reverse the environmental damage, which can be the cause of this liver inflammation, or your body. You can also promote cell regeneration. This is the hallmark of stem cell regeneration. So if the liver is for them, like, remember that Pharmaceutica was talking about how scarce is liver, because you cannot donate your liver while alive. So for those few liver donations, the liver bank we have, due to some people that willingly give their liver out when they know that they can't survive any longer. So they donate their liver and they put it in liver. So to get a replacement of liver, it is as very, very scarce as anything. So, but with the stem cell, SC30 particularly, you don't need any liver donation. The SC30 being a stem cell has ability to it can promote a regeneration of a new cell of the liver. And if the liver has been totally damaged that needs replacement, this can be done through the cellular level by allowing your body to produce a new liver that will replace the damaged one. And let me quickly rush to this. He's talking about antiviral. That's one of the ways to treat the liver problem, like this hepatitis C. When you look at some of the even the new ingredients we have in XCC30, it contains antioxidants, antioxidants, omega fatty acids, and antiviral and inflammatory properties. With the presence of these even prickly pear capsules, one of the ingredients is that it can take care of any challenges that antiviral treatment. So the best product or the best treatment for any inflammation of the liver, either hepatitis C or B or any hepatitis generally, is SC30 in combination with our super life colon care, because that most of these challenges go to your colon. So you can remove from your body. So SC30 and XCC Plus is the best ever combination that can treat any kind of hepatitis, particularly the hepatitis C that we are treating today. Like I told you, based on the studies, there is no vaccine currently for hepatitis C. So with our SC30, there is no need for you to look for any antiviral drugs or any antiretroviral drugs or any liver donation or any kind of even liver hepatitis C vaccine. So this SC30 can stand in the gap better even than those ones, because it is organically, and not only that, because it even works at the cellular level, so it can penetrate into the system even better off, because it goes through sublingual administration that through your bloodstream can go into your bone marrow, where cells and tissue emanated for, and increase the numbers of circulating stem cells from the bone marrow in your body, and makes cell regeneration, cell repair, and replications of the new cells, and the body will become brand new. So irrespective of how damage is, either it is mild or severe or chronic damage occurred because of this hepatitis C problem, our SC30 and our SCC Plus with the new device, our Estera, can give you total or permanent solution to any kind of hepatitis, or even particularly hepatitis C. So, like I said, I want to congratulate everybody on our Zoom call tonight, because the problem we are discussing tonight has a solution, not just a temporary solution, but a permanent solution to our product. And from the analysis of our medical doctor, Dr. Rose, and the Pharmaceutica, we have seen how these viruses operated, and we have seen even the diagnosis and even the treatment. And we have confirmed that SC30 and Superlife product is the best solution or best treatment for these challenges. Everybody on the Zoom, loved ones, or you know any loved one. It's not only that, because our is also anti, that it can also prevent. So even if you are here tonight and you have not come across or you have not been infected with this hepatitis, particularly the hepatitis C, HSTAT can be a safeguard for you, can safeguard you from contracting this virus, because it will increase the functions of your cells, and allows you to have high level of immune system, because you know that when it comes to virus, the level of your immunity will determine how vulnerable you become to any kind of virus. So every strategy can increase your immune function. So even if you have not fought across this problem, you can be rest assured, if you are using our product, it can also help as a preventive measures for you not to contact this virus. Even when you are exposed to it, your body your body's cells, your body's antibodies, which is your immune cells, can be able to attack any virus coming into your body and protect you against this damage. So that is that about it. So please, I want to employ us to please anyone that we know that is suffering from this problem, don't hesitate to recommend them to us by giving us any contact, maybe our director or myself or any of our doctor, to examine the medical diagnosis, so that we know the exact kind of hepatitis they are suffering from, so that for us to make a very concrete and solutions to treat this problem, and the testimony will follow. So thank you very much for this.
Thank you, Coach Sampson. Thank you for the very unique summary. You have just said it, you have just nailed it. Yeah, we want to use this workshop, so it's just like a symposium. The reality, the things that plays out there in the health industry, day by day, people are falling sick, people are going for lab, people are coming out with their results, they are going for drugs and what have you. And just like both Dr. Rolf and Pharmacilaka have just made it, just like play it back to us to see what happened. More especially this hepatitis. It's not we shouldn't take it for granted at all. Daily.
No.
Now, there is a selling point on what Pharmacilaka mentioned, that it's not a small, they call it a big man sickness. That those who can afford even to come and approach the drug side. And at the end of the day, if we can hear him clearly, many of them either could go for even to register with an NGO and what have you, but it's not guaranteed. And there comes the one that God has given to us, to entire mankind, the entire globe, which is plant-based stem cell therapy. And it has been proven itself. He said discovered by nature, realized by science. And for how many years now? Over 7 years now, still counting. Different countries are coming with tremendous testimony. And I want to thank God for using the corporate, the Malaysia, who just maintain the sanctity and integrity the way God gave it to them. They have never compromised the standard. Rather, it has been optimizing it. So it's something that we want to use this kind of workshop and forum on how to create the awareness to our own brothers and sisters here in Nigeria and in Africa at large, so that as many that are having this kind of challenges or their loved ones, let them come and use these products, not just that they will recover, but they will not have any. It will be a permanent solution. Our corporates, from onset, they have a foundation. They have a foundation attached to the company. We have been believing God that it will not take too long for Nigeria to have the branch of that foundation, so that as many who needed that kind of a support, but for now, something is still ongoing on that. So if you have people that are that are in this kind of situation, even though that it's necessary that they really go for their medical procedures, even though that it's very necessary that whatever the prescription given to them, that they should keep to it, but they should include these products. It gladdens my heart when I saw some prescriptions from federal medical centers, including our products, adding our product in their prescription, meaning that they are bold to state it there. So please, it's not something a regenerative medicine is not something that we should be looking at as if it's a multivitamin. Something like it's far above that, so that we'll help our brothers and our sisters out there before it's too late. So these are the things I want us to take home. But please, if there are any questions, which I believe there should be, can we just go to the chat room and drop those questions, so that we'll use the few minutes. We have been having a serious network challenges that even affected our incentive data that we normally share. It seriously affected it. So, but thank God for the committed early bird partners who knows the value that Friday meetings like this. They went out of their way. So one of them told me, my glow, that is the one I used to use before, but today it get as it be. As it didn't give me the kind of service I need. I have to use my MTN. It means that person have already prepared himself, both Glow and MTN. So when MTN is Glow is failing, I use MTN to be in the meeting. Some could be MTN and Airtel. So please, let's prepare and prepare ourselves on a Friday like this, so that there should be nothing will take us unaware. So we know that what we are standing out for is for the humanity, and heaven will bear a good testimony for you and I here in this part of the world. So I thank God for all the experts, Dr. Rove, and Dr. Samachilaka, Coach Sampson. Time now might still not permit us to talk about maybe the other side. The only thing I can just tell you that please feel comfortable each time you want to get our product, and you must connect to us as a customer. You don't get any product from somebody that is reselling to you. Whoever that want to resell product to you, that person is selling fake products to you. That's number one. Number two, any so-called super product you see in any pharmaceutical store, that product is fake. We have not in any way have any MOU with any pharmacy in Nigeria for now, because we have seen that the fake, those that are really parading the fake, have really used some pharmacies in the country to become their hiding place, knowing fully well that innocent Nigerians that will come and see the product there will assume that it's genuine. So please, Any product in such shelf is not from us. So only our super life product can get from the only genuine source. And through you to the company, we are connecting you to our company in Malaysia. Nobody is reselling to you. It means that you just give us your valid ID card and your valid voter's email address. Valid ID card, which could be either your NIN, your voter's card, or driver's license, or international passport. Any of these three, any of these four is good to go. Then valid email address will register you to the company's website. You can begin to have correspondence with the company. That means that whatever price you receive from us, you can confirm from the company if it is the same, the price, whatever. So we are not reselling. We are not meant to resell to you. And after your first registration, the next chapter open for you that any other thing that you start reordering, you will be getting it at the company's discounted price. There are a lot of incentives for connecting you as a customer to the company. You will start enjoying those benefits. While we are still waiting for the main foundation to be here in Nigeria, while we are still waiting for it. So please come and join us and let the campaign begin to reach far and wide. I believe that will make the foundation to be faster. Such foundation is already in South Africa. Why won't it be in Nigeria? So please, is in our hands. So thank you for your time. I don't know if there is any question at the chat room. Time is fast spent considering the network. Dr. Rove?
From my end here, I can't see any question.
No question. Okay, please. Thank you, sir. Thank you, sir. I think we need to, let's just go straight to share the grace. Thank God for the grace. Once ago, may the grace of our Lord Jesus Christ, the love of the Holy Spirit,
Abide with us now,
be and abide with us now and forevermore.
Amen.
Surely,
God's goodness and mercy
all the
shall
days of my
follow
life,
us all the days
all
of
the
our
days
lives,
of my life,
forever
and we shall dwell in the house of the
Lord.
Lord, house of the Lord,
Super life,
forever and ever. Amen.
super life.
Life is super.
I do.
Good night.
Good night.
Good night, everybody.
Good night.
Boo.